Good day, S4OM community. Welcome to Conversations with the Oncology Care Team, a webinar series sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. Our goal is to provide information to help massage therapists and estheticians support their growth as practitioners with enhanced knowledge of current oncology care options. My name is Ericka Clinton, and I will serve as the moderator for our dialogue today with Susan Crawford. Susan is a clinical social worker with a BA in Psychology and Human Services from the State University of New York and an MSW from the University of Connecticut. Susan has worked in healthcare for the past 24 years, primarily in palliative care, and more recently in oncology social work at Smilow Cancer Hospital. She has been privileged to advocate for and collaborate with integrative medicine practitioners in a hospital setting during the course of her career. Thank you so much, Susan, for joining us today. We really are excited to have you.
Thank you, Ericka. I was so delighted to be asked to participate, and I'm open to any questions.
Wonderful, wonderful. So I usually like to start off by helping our practitioners understand the work that the professionals that we speak to do. So could you give us an explanation of what a clinical social worker is responsible for, especially in a hospital setting?
Sure. I worked my work in palliative care for many years. I went from that and I went into oncology. And this is just a little bit of a background story. When I went into oncology, I said, I don't know too much about cancer. A lot of my palliative care work was in an ICU setting or a medical setting. And I was very worried. Okay, well, how will I be at doing this job when I know a little bit about cancer, but not a lot? And a wise manager I had at the time said, the job of a social worker in any type of a hospital setting is to find the person in the patient. And it was so helpful. And I say that to people who are following me, who are new to the field. Listen, you got great clinical skills. You use your clinical skills to find that person who has cancer, who has this other medical diagnosis. And that's how you can best help them, to try to find out, now, who are your supports? Who are you? What does your day-to-day life look like? Do you have a job? Do you have children? Do you have a dog? Do you have good coping skills? Are you safe in the environment that you're at? But do you have spiritual supports? What are those? How do you typically cope when something really difficult is happening in your life? And how will you use those coping skills to cope with the crisis of cancer? So are those skills adaptive or maladaptive in the current situation? And how can we help you to develop skills that will be most helpful as you go through a cancer treatment, a diagnosis treatment, and that whole process of stages that one enters into of shock, anger, questioning, and how do I put one foot in front of the other when I'm trying to maintain a job and I'm trying to help my children out. And so all of those things that when we do an initial assessment, our hope is to touch a little bit on those things so we can get to know that person. And what are your fears? That's often very much my first question. What are you most worried about? Because so often I can assume by reading a patient's record that, they're going to be worried about this, and this. And so my tendency might be to say, okay, well, these are the things we can help you with. At the same time, I want to be very attentive to the fact that it's not my agenda. And then, these are things that might be of concern, but maybe my primary concern is, how am I going to get there? I don't have anybody that can help me get there. Can you help me, get the resources that I need and the supports that I need? Or I don't know how to tell my children that I have cancer. I don't know how to tell my husband that I have cancer. How am I going to do that? I can't find words. I can't find the courage. I'm so terribly frightened. And for me to say this out loud will make it more real. Can we take a step-by-step approach to how will we manage these things? But primarily, what's your biggest worry? Okay, what are your other worries? How else might we help? Or let's focus on these right now. But we also want to let you know that social work can be available for this and this and this and this and this. There's a lot of good resources out there that we can refer you to. We can be here for your first chemo treatment so that, we can be available to give you the support that you need and give the nurses the support that they need and the doctors as they're treating you.
That's amazing. And I have to say that I walked into this conversation with probably a very big misperception about what a social worker does. Although I have always appreciated the work that they do, in my mind, it was like identify the resources and manifest whatever this person needs. Not really thinking that that aspect of finding the person within the patient is, yes, about guiding them toward resources, but more so about figuring out or getting them to identify what they need. Because, as you so beautifully said, they will identify the things that are most important to them, as opposed to the things that you think they may need. Right.
Yeah. And Ericka, I appreciate you saying that because I think it is a common misconception that in a hospital setting of any type, inpatient or outpatient, that the social work role is to find resources. And that is certainly a huge part of what we do. And sometimes it's one of those things that we enter into as a way of building trust with somebody so we can get to those other things and develop a relationship with somebody. But in the cancer centers, in palliative care, it's clinical social work. And so people are licensed for social work and have those skills to be able to do the counseling, to do the assessments that are most appropriate, and to make the referrals that would be most appropriate. Much of our time is truly spent on those resources that you spoke about. And that's hugely important, naturally, a mom with kids. A single woman with a job, they're not going to be able to do for a while. So there are financial resources. There are transportation resources. We partner with national organizations like yourself with the massage with our dear Julie and, the American Cancer Society. Smilow has a whole network of support groups that we can refer people to. We have the individual counselors we can refer people to. So it's a network of people and resources. The financial resources are, Pink Purse Society, Ron Foley, Connecticut Sports Foundation, Joanne Drewsy Fund. We partner with all of those folks as well. We're very fortunate at Smilow at St. Francis to have financial navigators who, when we're able to identify that somebody has a financial need, we can request their assistance in following up with getting the necessary paperwork and signatures and to do the detailed work of getting that financial assistance for our patients. So that's been relatively new and very welcome so that we can focus on helping people develop coping skills and such.
That's amazing. That's amazing. And obviously a lot of great organizations who really want to support what you do at Smilow. So in terms of working in healthcare, right? You've been doing that 20 plus years. What do you find is the most challenging part of working in our current healthcare system?
I think that there's been a lot of changes which have been brought about, I mean, certainly more recently with COVID, that it truly is a financial crisis in healthcare because of the loss financially to the institutions. And that has impacted every hospital system that I'm aware of. The challenge in that is to collaborate better and to find those resources out in the community that can help us do our jobs better to best provide for patients. And I see that in our management teams that are just constantly updating systems. And, there's just been a whole new level of challenge. And I'm awed when I see, the things that are coming out every day with changes, even for scheduling, things of that nature, that are very complicated issues.
Mm-hmm.
So I think the financial resources have really been spent, but that, leadership is very capable and they're coming up with new systems to help with that. I think that also in the healthcare world, everything is so finely specialized. So even as we speak of, oncology, social work, so we do oncology, and then there's the palliative social workers and they do palliative care. And I want to say, I always did palliative. That's my thing. I always did palliative care. And yet there's a different support system in place as somebody's nearing the end of life. So there's not the smooth transition in our healthcare providers that there used to be more of in my life. But
Yes.
as things become more specialized, then you introduce new people, and it's not as smooth a transition for me in my work. Although I often sneak up to the floors to be with my patients as they're leaving this world. So,
so challenges are one thing. And as you said, I think there's kind of like a good and bad to the challenge, right? We get to maybe see things in a different way. Sometimes the technology helps us reach more people, but there is some level of connectivity that has been lost or shifted by that specialization. And I think we see it a lot when we deal in oncology or palliative care. But what would you say for you has been the most rewarding part of working in healthcare?
For me, it's really been remarkable to go from palliative care to oncology in the sense that my perception of, what was happening in oncology world was very different from when I came into the field. I'm just amazed at, like, I've always been a believer in miracles of some type. But I have to tell you that I've just seen so many since I've worked in oncology, in the sense that, I look at these reports, I think I get them. I think, wow. And people have been living such long lives with very severe disease. One of the most rewarding things for me is I run a group for women who have advanced illness. And I have one woman who has been living since diagnosis of a metastatic breast cancer for 16 years on the same medication. And it's remarkable and it's so helpful to have someone like her join someone in that group who just got diagnosed. We can convey a sense of hopefulness and the different types of interventions that are now available for cancer never existed before, and the immunotherapies and the radiation treatments and all of those things that really, I would say, in the last 5 or 10 years have just like exploded, and every day there's new things. So that's been very rewarding to do the group, to see how the women in the group support one another and how I can be a presence to it. And that's how I feel. It's like I may be the leader, so-called. My job is to get people together. And they do like such an amazing job for one another to be there and to be present. So I just can kind of sit in awe and, you know, congratulate them for being such amazing people and doing such amazing things. So that's been hugely rewarding for me.
That's wonderful. I always say that the fact that we get to bear witness to so many things or experiences in people's lives as the practitioners that we are is the most amazing and awe-inspiring thing.
Mhm.
You know, hard as the work may be, that's the part that makes it so exceptional every day.
You're absolutely right. You're absolutely right.
So I guess one other question I would like to ask is something that you touched on a little bit, but I think you might have some insight for us in terms of how can we as professionals be better at collaborating with each other when we support our cancer patients?
You said presence, and I don't know, maybe I said it too. I don't know, but I think as I begin to kind of wrap up my career and things, I know that as time has gone on, that I feel less of a presence, as in some ways I'm disengaging, from this process. But I think that one can be available just to kind of walk through the infusion areas and walk through the halls. And, people might say, "Are you lost?" And sometimes my walking through is because I'm lost. But other times it's because I'm looking for someone. And in that process, I find something that I didn't know I was looking for, in the
Mm,
sense of that presence of being, okay, no, I didn't realize this. Oh, someone today said to me, thank you for recognizing the beautiful flowers I brought in. And it was like, well, of course. And she's like, it makes it so much of a friendlier place. So to be able to extend a smile, to be able to say, hey, listen, it looks like you're having a bad day. How can I help out? Or just to lend a hug to one of the nurses who, the infusion is just, it's incredible, the intensity of the knowledge that they need to have and the intensity of concentration to make sure that they're doing the right dosing. They're attentive to the patient. They're attentive to the fact that there's these psychosocial needs. That I think it starts with being present to one another. And then that gets very well conveyed, I think, to the patient when they know that you have this working relationship that might be a little bit silly sometime, or we might, just touch each other and say, listen, have a good day. That matters. It matters a lot, and it helps to collaborate in the future. And as I think about, like Julie, bringing massage onto the units, whether it's inpatient or outpatient, her presence matters in the sense that she walks on and you almost feel that sigh of, oh, Julie's here. So you know Julie, and you know her gentle presence, and she's just such a wonderful person in herself. She doesn't have to touch anybody. She doesn't have to do massage. Julie's here. Oh, good. Can you see so and so here? Can you see so and so here? I think early on it was kind of like palliative care was very early on. Who are
mhm.
these people and why are they here? And so it took a long time to, practitioners to be open to the development of massage and integrative medicine in the units, on the units, in all different levels. But it makes such a difference when you can say, so and so in room 7 is really having a tough time. Can you go in? Or so and so, has a bit of a history. They might not want to be touched, but your presence will matter to that person. And for Julie to be able to get back to us to say, this is what the person, said, or this is how the person reacted. And so often it's a way Julie can bring anybody. The massage, I know for myself, when I've had massage, I've been brought to tears at times. And I can't necessarily name that. And there's so many things that a cancer patient might be crying about. But it's not, oh my gosh, they're crying and I have to go get somebody else. But they're crying. It's okay. Let it out and just will be present to your sadness. That's all we need to do. We don't need to get a therapist. We don't need to get drugs. We're just being human and touching one another emotionally and physically in some ways. And it matters.
That's wonderful. So as the clinical social worker, do you recommend massage or do you request it for certain patients?
Yes. So, we know Julie's days. And also she makes her presence known. So we can say, oh, good. Can you go see so-and-so in room? Or we have patients who we know are inpatient up on the units upstairs. So we can make referrals there. I think across the board, the nurses are fantastic at making their referrals. So everybody on the team is now alerted to the fact that this is Julie's coming in. It's her day. Here she is. Can you go see so-and-so in whatever room? So that's just becoming, okay, this is great. She's here. So the referrals happen. In terms of outpatient, we have some opportunities to introduce some of our patients to integrative medicine because there is a local JCC and their integrative medicine program has a Mondays at the J program where people haven't tried integrative medicine before. It's an opportunity for them to meet other cancer patients and to go and get some free support services that might be helpful and not have that thought that, I can't go because I don't have hair, or I can't go because I can't afford it, or it's too far away. So it's close by to this area in a community that's comfortable for people to say, it's other cancer patients, it's okay. So that really has made a huge difference, I think.
That's wonderful. That's wonderful. So when you refer people for massage, is it for any number of things or more emotional aspects, more physical aspects, both?
I think it's, for the most part, it's both. For the most part, I let people know about the service and you can usually tell whether they're, oh yeah, I'm into that, or I've done that and I will follow up, or, I can't imagine anything like that. And I think that that's what makes it so nice to have Julie here, because they don't have to go someplace. They can get like a little bit of a sense of what it would be like to be able to have an extended period of time when Julie is able to enter the room and can be more open to the possibilities of things like Reiki and so. We used to have, prior to the COVID, we did have much more in terms of there's a serenity space in our women's center. And we used to do the drumming, and we had people that came and did Reiki and massage and craniosacral therapies. So it was a great way to expose people. And my hope is that will come back. It needs to come back.
And I think we're entering the time period where we're figuring all of that out, like how safe everything is. And a lot of what we decided wasn't essential is essential.
Yes.
And now should be returned to, our various healthcare settings. Because it just, the outcomes are better. The more people have, I think the easier they can fight for themselves.
Yeah.
And hopefully achieve some level of wellness. Susan, thank you so much. I have really learned a lot, and I have so appreciated all the information you shared with us. And I really hope the folks that are listening got a lot of useful information, but it was a joy to speak to you. Thank you. Thank you. Thank you.
Ericka, thank you. I'm so delighted to have been asked, and all the best wishes. And I'm probably going to do a lot of massages and Reiki and such in my retirement. So I look forward to it.
That's wonderful. That's wonderful. All right, collaborators, have a great day. I hope you enjoyed today's podcast with Susan Crawford. Take care.
Bye-bye.